You know, when we assess a patient who's been diagnosed with lung cancer, we start off wanting to know what the stage of their cancer is. That helps us make the big picture plan as to where we're going. Their treatment may involve surgery, radiation, chemotherapy, or combination of all those things. At Franciscan, we have a team of doctors that works together to bring these options together for a patient.
We know that early detection is the key. Lung cancer typically doesn't cause any symptoms until it's really advanced.
With the chest CT program, it is a way for us to find those nodules earlier and perhaps catch that cancer at an earlier stage.
We can treat them up front and give them a better chance of survival.
Instead of the patient traveling, we all travel to one clinic. We review all the cases prior to seeing patients.
What is the best option for that individual patient is a complex decision making.
All of those eyes are on your scans, are on your medical history.
You have not only my opinion, but you have 4 other doctors' opinions as well.
The nurse navigator is the first contact with the patient, coordinates their care.
Well, I like to say is a patient's personal concierge, someone who takes their hand and goes down that new road with them.
We are one of 2 programs in the state who bring interventional pulmonology expertise. So what that typically involves for the patient is they will come in, they'll be put under general anesthesia, and we go down with a scope in their airways. And then while they're asleep, we do all the diagnostic workup, both diagnosis and staging, and come out. It's a same-day procedure. They're watched for 1 or 2 hours after the procedure. They go home, we get the answer in 3-4 days, and then you move on to the next step of treating the patients.
It allows us to do the surgery without having to spread ribs, to do surgery with smaller incisions.
I think patients who come to Franciscan for lung cancer care can know that they are receiving the care of a real multidisciplinary team, that we need the assistance of the whole team to manage some of these really challenging cases with lung cancer.
And there's a very new treatment now called stereotactic body radiation. And this is for early stage lung cancer, and we can treat patients now who are not eligible for surgery in just 4 treatments as an outpatient and get very high cure rates. Patients continue to work during the course of therapy. It takes about an hour each day. Very minimal side effects. So it's a very exciting part of our field.
There are folks out there at risk for lung cancer, and there are ways for us to identify this early. Those patients benefit from getting a once-a-year CAT scan of the chest. It's a very easy thing to do, very safe, where we can often identify lung cancers early, and the earlier you catch a lung cancer, the better chance you have at a cure.
They care here, they love here. They truly believe in the mission and what they're doing, and they show it every day in every way.